everyone on here. Dr. Kirren and I have been talking for quite some time. I've been really inspired by her work. As someone who wants to pursue a career in psychiatry, I just think I can learn so much from psychologists such as yourself, who I hope to be working alongside a lot. So for our lovely audience, please introduce yourself.
So I'm Kirren Schnack. I'm a clinical psychologist. I've worked as a psychologist for 18 years now, so I've had a long time. I think I definitely have to say this because it comes up all the time on in my life and on Instagram, because I probably look in younger than I am, but I am in my mid-40s, Ali. So I'll say that because sometimes people say I'm not a millennial. I'm one of
You certainly look like one.
I have 5 siblings. My youngest brother actually is a millennial, but I've worked a lot with millennials, mainly students, because I worked in the university at Oxford as a psychologist, and I've worked with young people with psychosis. I worked in so many services with young people, and I think that I guess I like to think that I'm quite young at heart still. My children call me childish, or I think somebody referred to me as a lady once, and my eldest, who is a teen, said that she's not a lady, she's a girl. So hey,
all these little things, hey?
Yes.
I mean, I get asked all the time, like right now I decided to, because why not, it's been COVID and I've not been wearing anything other than trackies, scrubs and no makeup. I thought, doing a live, always try and look nice for it, but I always get mistaken on the wards for a work experience student, or even when I'm going to, back in the day when we could go to the cinema, I've always been mistaken for my younger brother's younger sibling, and have struggled to get into 15s, and I'm 25.
Oh,
so we've got that in common.
How does that make you feel at work when you're yeah,
I mean, that's a whole nother live. I think that would actually be an incredible discussion to have. There's definitely pros and cons. I think most of the time I feel frustrated, just because it makes me less, not that I need to be authoritative, but it makes me less assertive to them, because they think I'm so young, and that I'm not meant to be there, when really it's been 7 years since I left school. But anyhow, I think that we could do that another time.
Yeah, let's do that another time.
Really good to discuss the kind of role of appearance and age and things like that, and being female and blah blah blah. But anyhow, not on to you. So so you are a clinical psychologist, as you've said. You've done a lot of work with young people, and you've got a millennial brother. So you've had a lot of experience of us folk. I am going to just start off by telling everyone what millennials are in the kind of theoretical terms. So millennials are people who are from the early 1980s. So they were born in the early 1980s, going to the late 1990s. So I am a millennial, but 40-year-olds are also a millennial. So it is quite a wide bracket. But millennials are also known as Generation Y. So Generation Y comes after Generation X, which is known as the baby boomers generation. And Generation Y precedes Generation Z, which is people who are late 1990s all the way to the 2010s. And then, you won't believe it, it does go on. There is life after Generation Z. It then gets into Generation Alpha, which is basically everyone who was born 2010 to the present day now. So that's where we're kind of at with the kind of anthropological look of where us as a generation sits within the grand scheme of things. So I just wanted to start off by asking you, what do you think when you hear the word millennials? What are the first things that come to mind with all the associations in the press, in your line of work, whatever it is?
I think, millennials have had a really hard time, actually. And I think because, I see myself as someone who's not judgmental and doesn't put people into a box. And I think millennials as society has tried to put them into a box, and not let them, exist outside the normal societal norms.
Mm-hmm.
I don't have a particular view of millennials, Ali. Because it's so dangerous to kind of generalize people instead of seeing them as individuals. And I think that's part of the problem that I have with, people attaching terms like snowflake, or saying millennials are people that are lazy, or they're narcissists, they're self-entitled, they all eat avocado on toast and like to drink coffee. Actually they're not a selfie obsessed and phone addicted generation of young people. And I think millennials have brought about so much change with the technology and the cultural changes that we've had in society, that millennials have been a big part of. And I think often the things that they should be valued for are not recognised, and some of their choices that sit outside the norms are frowned upon. But it does make me think, older, there isn't a generation. I was thinking about, looking back through old records of how people viewed young people. And I think for the last 2,000 years, there isn't, the criticisms of young people are actually remarkably similar to what they are now. And I don't think there is a time when people haven't moaned about young people. I think it is a bit worse for millennials. It's hard to obviously quantify and measure, but I think they get a bad rap, and I think people hold prejudice or stereotype against millennials. When I meet someone who fits into that age category, the definition that you've given, I don't have in my head that I'm meeting someone who's a millennial. It's just a person, an individual. But I do have colleagues that say, they're a millennial, or they're a private educated millennial, and they've wasted their parents' fortune on education and now they're jobless. But there's such an unkind rhetoric around the identity of millennials, and who are we to decide, or anybody, who they are and how they are, and that there's something wrong with how they are. And I think let people have their own self-identity and speak for themselves.
That is so well said. And obviously I love the fact that you're open-minded, and that you do hold the values you hold in not putting anyone in a box. I guess that is very much in line with being a clinical psychologist. But I think it's important that we examine the kind of positives and the negatives around the associations that millennials get, and really just try and explore and unpick them to understand why they get that kind of stigma and why they get pigeonholed. So starting off with, a few of the comments that you made around millennials being seen as lazy, entitled, narcissistic. I know that there's a psychologist in the States who does a lot of work around millennials in the workspace and trying to get organizations to understand the mindset of their younger employees. And she refers to them as Generation Me. So I wanted to just unpick that a bit and see if we can just, really look at the nuanced view, but also the kind of evidence to why people might view millennials like this, and where this kind of attachment comes from. So what do you think?
Yeah, I do think I think it's unfair, actually. And I think I've been really struck by the disconnect between the way millennials are portrayed and the way that they actually are when you meet them or work with them, and that no generation fits into a stereotype. I think there's behavioural characteristics or cultural characteristics of being from a certain time, but I think this idea that millennials are the me generation and self-obsessed. I think there's some statistics I read on this that they're more likely to have more than 3 social media accounts. They're more likely to put their face out there than previous generations. They're more likely to put a video of themselves on the internet. And actually, I think an interesting statistic is 1 in 4 have tattoos, and of those 1 in 4, 25% actually have more than 4 tattoos or piercings. And that this is about self-expression, and that they're more self-expressive. And I think that, to say that they're me generation, they're born into the, near enough born, a lot of them are born into the digital age. And that's when self-expression became more of a thing for people. And I think that they were born into a world where there's a ready-made platform on which to, show yourself, engage with your friends and engage with the world. So why would they not be like that? And I think that they're a product of their time and of the culture. And I think that that's misinterpreted sometimes as narcissistic and self-focused. And I have a real problem with the, you know, people calling millennials narcissistic, because, you know, I think sometimes people say, oh, narcissistic personality disorder obviously is a very serious condition. But there's healthy narcissism. You know, at this end of the scale, we're talking about healthy narcissism, where you can be self-confident and assertive, and, you know, 40% of the population have narcissistic traits that are not problematic, and in fact they help and enhance their functioning. And then at this side, we're talking about really dysfunctional narcissistic personality disorder. So I think that it's such a, sometimes, you know, for psychologists, it annoys quite a lot of my colleagues as well, that these terms are used as something quite derogatory, when actually there is such a thing as a healthy level of narcissism, which we could just say that, you know, it's a confidence. They're born into a time of self-expression, and that's great. We should be celebrating that actually young people are becoming more confident and do want to put themselves out there. That's a great thing.
Yeah, I think honestly, I love how you've just put it all, because it just really makes sense. And you know, just observing kind of young doctors, for instance, and nurses and other allied healthcare professionals on the wards, you know, I'm seeing a lot more of piercings, I'm seeing a lot more of tattoos, I'm seeing a lot more of pink hair and cooler haircuts that aren't so kind of, you know, part of the status quo. So I'm really, you know, experiencing this idea of individualism and self-expression every day in my workplace. And I know that a lot of my friends who are in different industries as well, that the whole workspace environment has even changed, all in line with kind of self-expression. So there are a lot of like startup offices, or even like, you know, some law firms are really progressive, and they have like bring your dog to work, bring and kind of like wellness kind of aspects to the work environment, as well as some, I think, even have bars to let loose at the end of the day. And it's all this idea around kind of less rigid, I think, social rules. So for the individual and the appearance, so having kind of the acceptance around tattoos and piercings, like I've got my nose ring in at the wards, and I don't personally feel like it makes me any less of a professional. Maybe I know my boyfriend's grandpa once made a comment about it, because he's not used to it. He's not used to seeing young girls with kind of facial piercing. But I've never, you know, really been, I know people who have, I've never been called up on it in the workplace. But yeah, so you have all these things about appearance being more individualized, even when you have to wear a uniform, such as scrubs or policemen, whatever it is. And then you've got the actual work environment appearance also changing, and being not so much with hospitals, because they are quite a sterile environment, but you know, with all these kind of corporate places being much more unique and having like much more personality, rather than just this is where we work. You go play outside of work. But it's now kind of, I'm seeing a little bit more of a kind of merge of the two. Do you agree?
Yeah, definitely. And I think not so much obviously in public services like in the NHS, but in corporate, that is definitely something that is more, I'm seeing more and more. My husband works for a tech company based in Santa Clara, and some of the founders were actually millennials, the founders of the technology was created by millennials, and the ethos and the work and the approach to work is completely different than some of the, you know, more traditional older companies. And I think this is one of the, you know, really positive things about millennials, that they have the, you know, this individualism and self-expression that previous generations have not experienced. There's no studies on this yet, but I suspect it is something to do with, you know, the culture change that's taken place as a result of technology as well, and the exposure that we have to the wider world. But yeah, there is that shift, and I think Google and places like WeWork, all these kinds of campuses where people, and there's so many millennials that choose to not follow the standard kind of, you know, get a job and have a career, you know, in a certain vocation. They want to set up their own businesses, they want to be entrepreneurs, they find things to do, and they've got access to technology in the world, and they come up with fantastic ideas. So I think there's a shift away from that traditional culture of work, not just in terms of, you know, how you express yourself at work, but also the kind of work that you do. It's so interesting you said about your piercings. When I went for my interview, I went for an interview many years ago, and my supervisor, who was a consultant, told me at the time that I probably ought to take out my nose piercing for the interview, because it might really help. So I did. and it closed
Yeah.
up. Times
I
moved
mean,
on, so it's so great to see doctors wearing piercings.
yeah, I mean,
having tattoos.
they're definitely like my friends. I've just kind of been lucky, I guess, but I know a lot of my friends have been caught out on it, and yeah, like by kind of older consultants who find it really shocking. But I mean, hopefully things can change more and more and becomes more mainstream rather than just some people accepting it and some people not. But I wanted to really unpick what you've just said about talking about, I think, if we call it the cognitive flexibility of millennials and how they're very creative in how they view their lives and their career kind of options. So like you said, a lot, you know, think to themselves, do you know what, I don't actually need to go to university because I want to go into XYZ and it will just slow me down by getting a degree. It's just kind of an accreditation. I know like some of my friends have thought exactly like this. They've been very successful in not taking that path because it's not been necessary. And likewise, I have a really close friend, for instance, he very clever guy, he did economics and management at Oxford and then ended up getting a grad scheme at Barclays Investment Bank, and then decided, you know what, tech's my passion, turned down the grad scheme and literally just went off on his own, learned how to code, and that's what he does now. He's freelance coding. And I just find it really fascinating how you spoke, this is what I want to speak about, you spoke about in the Metro about how millennials are somewhat kind of getting into the rhythm of not following the exact path that their parents and future and previous generations have followed, with going to school if you're fortunate and can afford it, going to university for even higher education, getting married, settling down, the whole kind of linear trajectory. I find it really interesting how that is something that you talk about. So I just wanted to see if we can elaborate a little bit more on it.
Yeah, of course. I think you know I think the journalist who's writing the Metro piece was a millennial herself and was living in a house at the time at the age of 31, sharing. And I remember speaking to her and I said to her, you know, in the 1920s, people used to get married and they didn't move into a house, they moved into a room with relatives because that's how people lived. And why, you know, it's so why is that different to being a millennial now and you're in a house share and everybody makes judgments about you not following the same path? I think, you know, one of my views is that if you're born into an age of technology, and it's when I say digital age, it's being born into, you know, the internet didn't exist when I was a teenager. It came when I was in my 20s. But, you know, people your age have been born into this kind of tech, and then came the digital age. That this has encouraged self-expression, and it's encouraged people to be individual, and it's encouraged people to have views that prevent gender stereotypes or prejudices. It's encouraged people to think in a way that you know, that why shouldn't gay people be allowed to get married? Why shouldn't somebody of a different race be not treated equally? Why should we be allowed to hurt the earth and the environment? So I think these the exposure to this kind of world through having access to technology and the internet and the world, I think it shapes the way millennials see things, and I think it's made them have a more individualistic identity rather than, you know, the kind of more narrow and very kind of flowcharty specific, you know, you go to university, you get a job, and then you meet somebody, you get married, and you have children. And actually, a lot of the millennials I meet say they're consciously making decisions, for example, to not have children. Most of them still want to own a house, but the recession has not been on their side. It's been quite difficult for many of them to get jobs. But I think that that's part of, you know, why they don't want to follow that standard course, and why should they? Why should we be expecting them to? Because, you know, they are a product of their program, which is the time that they're born into. So why would they not be different? Why would they not be having different values and choices? And why would they not be changing societal norms? I think it's an amazing thing.
Yeah, I mean, it is so interesting how from one generation to another us with me. You know, we've had a kind of delay in rites of passages. So, you know, going to get a job later on. I know like a few people who decided they just wanted to kind of travel and explore the world for like 3-4 years post uni and do whatever out there instead of, you know, getting straight to it and finding a job, which a lot of people in higher generations would think of that as kind of lazy and spoil, and you know, you hear all those different kind of opinions. And then you know, getting married later, not getting married at all, having kids later, especially with advances in fertility and things like that, and the fact that we are going to live for longer. So there have been all this kind of delay in rites of passage, and I find it really fascinating because it is such a stark contrast when I think about when my parents, you know, got married to when I'll probably get married. It is just so different. And then now my grandma got married at 19. It's just really changed from, you know, just a couple generations. And yeah, I just think it's such an interesting comparison to make. But what do you think are perhaps, so we've discussed some of the differences, what do you think are some of the similarities and core values that millennials still hold that align with previous generations?
Yeah, I think most millennials, as you know, they're still values and goals, two separate things. I think individuals have their own individual values. So I would hate to say that they, you know, all millennials value X, Y, Z. And I think, you know, one of the models that I use in psychology is acceptance and commitment, which is value driven. So each individual, you choose what your values are in terms of what do you value about work. Is it money? Is it making a small difference to lots of people or a big difference to a small number of people? Is it having free time? So I think individual like kind of values separate. But in terms of goals, most of the millennials that I've met and worked with, they do have very similar goals. They want security, they want financial security, they want to be able to have their own home if they can. You know, some of them want to have, you know, most of them want to have a partner. You know, some want to have children, some don't want to have children. And I think I say about children as well that millennials sometimes, I think, you know, with more knowledge and information being more widely available, and they're of the generation that will be the most what was it? I read a quote somewhere. It was that they will be the most not educated, but the most millennials that will have the most they're the most knowledge-driven generation of any of the previous generations, and I think that's linked with being born into the digital age. That, you know, people that, you know, millennials say about children that I don't really want to have. It's really big commitment and to have children, and it's not something to be ambivalent about. And they understand the impact of, you know, what a big parent is on you as an individual. So I think there are definitely similarities, and I think they create. It goes back to Maslow's hierarchy of needs, that, you know, shelter and food and money and all the things we need for survival. Those are not different. They are the same. And I think what really strikes me about millennials, and I think, you know, I first heard you on Radio 4 probably about 2 years ago, and you were on the radio with another doctor, talking about nutrition and about how doctors don't get any training in nutrition. And one of the things that I'm really struck by, that it's a similarity, but it's also a difference, that there's so many millennials that really want to change things and change, you know, make a small difference, but actually to a big part of the, you know, to a big difference in some ways, but to a small, it seems like, you know, it's a small focus thing, but it's going to have a big difference and impact on the world. So climate change or nutrition and these things, and they bring such amazing value and difference and change. So and that's something that is similar, because we all want to change things for the good and want the world to be a better place. So I could say that is a similarity that you see in millennials, but they're coming with a new and reckon force. Yeah.
I mean, obviously I'm biased because I really do try and kind of improve the reputation that millennials get. But I would say that something I really relate to with what you said. I do feel a really huge internal need to feel needed and create impact. I feel like I've been that way for quite, I don't, you know, maybe like mid-teens I started to feel that way. And it is really interesting when you look at the trends that a lot of millennials do feel that way and want to do activism work and want to do advocacy. When you look at a lot of young people who are really being disruptive at the moment, they are fighting for climate change. They are fighting for greater, you know, female entrepreneurship and, you know, closing that gender inequality gap. They are fighting for egalitarianism and just for, you know, greater understanding and tolerance to one another, which previous generations just haven't had. You know, a lot of millennials are very much open to understanding each other's race, understanding each other's culture, having that conversation rather than othering. I think it's really fascinating from speaking to friends, you know, just how inquisitive and curious the millennial mind is, and wanting to understand each other's individualism rather than just separate themselves from it and say, you're different to me, you're not part of my tribe, I'm not interested in you. So I kind of love that, very biased, but I kind of love that aspect. And I think it's really interesting how they are less prejudiced. They, you know, they are fighting for more and more rights. But then on the other hand, like I have read somewhere, for instance, if we talk about the LGBTQ plus community, I read somewhere that gay men today, so gay millennial men, for instance, don't always appreciate the struggle of gay men in previous generations and what they had to fight for to kind of get that social norm into play. You know, it shouldn't be part of the social norm. It is all normal and honest, you know. It's silly it gets that label, but do you know what I mean? I think there is also that kind of flip side, which I've read about, where my generation don't necessarily appreciate the struggles of previous generations. And I think that's the conversation I have often with my parents when we kind of just challenge the topic around resilience and mental health and things like that, and they kind of say, well, we had so much on, we had to fight for so much, we didn't have time to think about the little things, if that makes sense. They had a lot more pressure on those key foundations in Maslow's hierarchy, safety, all of that. When you think about like my grandparents' generation, like war, the people who lived through the war, their higher needs were not even accessible. So that's where I want to hear your take on this, but that's where I kind of see the bad, you know, kind of press that millennials get, is because we actually do probably have things easier. There are our own challenges, you know, social media and the impact that has on mental health, which our parents' generation, grandparents' generation didn't have. But then again, if you just exclude COVID from all of this, we don't have that external kind of drama that a lot of our parents and grandparents had to live through, with political instability and all that kind of thing. So I just wanted to hear your view on all of that.
It's so interesting, isn't it? You say that you think that you have it easier. Why do millennials think that they have it easier? Why is that, do you think? Do people...
Well, I mean, yeah, obviously my parents are probably watching this now and I love them too, but we definitely do differ on you know, things around who had it easy and who didn't. And I think what probably their perspective is they did not have the privilege to talk about their feelings as much as we do. They weren't allowed, they did not have permission to say, I'm struggling, I need help. They just had to get on with it. And that is what I hear when I talk to my friends' parents, when I talk to my senior colleagues. You just got on with it. If you had a problem with your boss, tough. If you had if you didn't like the feedback you got from a piece of work, or someone spoke to you rudely in a, you know, team meeting, tough. You just did not have the privilege to be able to speak up and try and make a difference with that. And the access just wasn't there. The ability for women especially to be career women and have that work-life balance, like, it just wasn't available. And there was just a lot more survival, I think, rather than living. But that, I mean, it's completely open to,
I think that because some millennials still, you know, millennials, in some ways don't have it easy, because it's not easy to be born into this, program age, and we'll know in years to come what the impact of that has been on mental health, for example. And I think it's really easy, isn't it, for parents? I don't mean your parents now. I see. I worked in child and adolescent in CAMS for nearly a decade. And parents would come in with their children. They say they don't know how good they've got it. And I say, correct, they don't know how good they got it because they're not you. And they don't know how privileged they are. Well, correct, they don't know how privileged they are because they're not you either. Because I think in the parents' mind, parents think of their own experience as a child while they're parenting their child. And I think they're comparing them the two, that, wow, my child's so privileged and has so much more than I did. But you've provided that environment for your child and that kind of life. And they know no different. Of course they don't know. And why should we be? I think it's unfair to expect them to realise how privileged and how amazing their opportunities, because there isn't, because it implies something mentally and emotionally unhealthy there, that you have to sit there and think about how lucky you are because other people are worse than you. And actually, what we know is that doesn't help people mentally. And patients say to me sometimes that I really shouldn't complain about my situation because, somebody in Syria is suffering, or there's a child somewhere starving to death. And I think, but knowing that does not change your emotional situation or take your emotional pain away. Or knowing that your parents had it harder than you doesn't suddenly make your depression and anxiety disappear. Because that's not how emotions work, and that's not how mental health works. That if it was that simple, we could sit there and ask people to visualize harder times, and then they'd become more reflective and resilient, and everything would be easier. And I think it's an unfair way to look at things. But I think so many parents do it. I sometimes, I try not to, but my husband probably does it more than me. He's not a psychologist, but we say, he will say, you don't know how good you've got it. And I say, correct, they don't know how good they've got it. It's not, but life's still not easy. And I think as individuals, wherever you are in life, there's joy and there's pain. It's just the source of your joy and pain is different. And I think we think of this generation has it so much easier. And actually, over time, we expect our generations, your children and my children and their children's children, I expect actually things to get better and better and better for each generation. That is something that we should expect to happen, and we should want to happen, and we should be pleased that it's happening.
Gosh, what wisdom that was. Yeah, that was so well said. So just unpicking what you said, you brought up the subject of resilience. So let's examine, why do you think that millennials get the kind of what all the time? So let's think, I've heard of snowflakes, I've heard of strawberries, because strawberries crush easily, and all these kind of negative associations, basically saying that millennials are weak and they're easily twitch, they complain a lot. So where do you think this kind of perception of millennials lack of resilience comes from? And do you think we can actually make a comparison between two separate generations' resilience, or do you think resilience is always about the context of which it's being used within?
No, I think you can make a comparison, because I think now mental health is something that is so much in the media, it's in society, it's on social media. Every second post on Instagram is about self-care and self-love. These are concepts that didn't exist in when I was a teenager or in my 20s, and definitely not in my parents' generation. And they were of the generation, they were immigrants. My dad travelled from South Asia in a car with 17 people by road through Russia to get to the UK, because he got a lottery visa in the lottery visa that they're handing out at the time. And I think there wasn't time for emotion. And I think when your psychological resources are taken up with survival, and we've talked about Maslow's hierarchy of needs, there's less opportunity to attend to everyday emotional needs because we're preoccupied with survival. That's one thing. And I think the other factor is that millennials have a world stage. They're more exposed to information, and there's more widely shared information about mental health and wellness, and we value people connecting with their emotional experience and expressing it. But then at the same time, there's such a rhetoric about, oh, here's a millennial getting all antsy and angry about somebody making a political statement, and here's another millennial claiming that there's 165 genders. You know, these kinds of things happen, but that's what we need to value, is that actually, isn't it such a great thing that these people can talk about and label and understand what they're feeling, and they feel assertive and confident enough to express it and object to other people's opinion, because we've moved through those times that have been really oppressive and difficult, whether that was for survival or poverty or, you know, migration, what the reasons were. That I think that there's more opportunity now, and I think over time that the world and lives and people and generations improve, there's more opportunity for each generation to be able to do things in a different way and have better access to health and education. And like you said earlier, we're living longer now as well. You know, these things, everything kind of improves with time, and that we should expect these improvements in expression and mental health. I think it's an amazing thing. But I think to be called a snowflake and a strawberry, I think it.
Oh yeah, it's because I just remembered, it's because strawberries bruise easily. That's
bruise. Because I've not heard the one about. I have heard about snowflakes, but not about strawberries. It's quite derogatory, isn't it, to call somebody by anything? Because it's almost, well, it is a prejudice that millennials are snowflakes. It's just, I don't appreciate it, and I think also, again, it's dangerous, isn't it, to say categorize everybody. I've not met one millennial I could say, oh, this is identical to the millennial that I met last week. That they're not. Are we going to say that a millennial expressing their emotionally charged opinion about something means that they're emotionally fragile and they're a snowflake? Or are we going to listen and attend to what they're saying and accept and validate their experience? And I think they get called snowflakes. That's my impression. They get called snowflakes because they keep putting their hand up and saying, hang on a minute, this is what I feel about that, or this is what I think about that. And that kind of expression, self-expression, is something that the older generations are not really used to, and society is not really used to.
Absolutely. I just want to take a moment and read the wonderful comments that we've got from this user, 110 mental health. Please don't say sorry for keeping messaging. I love you to carry on messaging, because it just, you know, makes Dr. Kirren and I feel like we're doing something right. So it says, oh my God, this is amazing. I'm currently on a psych unit, and it's very true that people always say things like, we have it good, we are lucky, etc. And it just invalidates feelings. We need more talks like this. Sorry to keep messaging, but in the midst of the loudness of this world, the screaming and shouting, this chat makes so much sense. Well, I hope that we are uplifting your time. I can't imagine really how difficult it must be for you right now, but thank you very much for your feedback. And yeah, anyone else, if you want to ask questions as we go, please do. We've only got around 20 more minutes left for this before Instagram kicks us off. So yeah, thank you so much for all your feedback. We've got more feedback from a lovely doctor who actually does a lot around millennials and their wellness. So she says, agree, this is a vital conversation. No one has the right to invalidate your feelings. Thank you, guys. Absolutely. Yeah, absolutely. So just touching upon what you've just said, I think another kind of phrase that's being thrown into the mix, like mixing with millennials a lot at the moment, and it kind of goes in with this snowflake conversation, is wokeness. You know, and I just wanted to get your kind of take on, do you think there is ever kind of a need to kind of have to pull the brakes on how, you know, woke and how open conversations get around what millennials bring to the table? Because obviously sometimes views can be really extreme and very much differ from anything that we've kind of thought so far.
Yeah. So about asking about whether everything that you think and feel as a millennial should be expressed, because sometimes it might be perceived or received as quite extreme.
Yeah. And just, you know, is there sometimes a need to have maybe greater self-awareness rather than saying we should validate everything? I'm just kind of turning it on its head. Is there kind of a need sometimes to pull back a little bit? Because I mean, I know from like a lot of you know, older colleagues I hear from, they really cannot relate to just how woke the world has become and how censored. You know, that's kind of what Piers Morgan is talking about at the moment with free speech, just how censored things have become, because anything you say can or will offend someone. So I just wanted to kind of get your take on that.
Yeah, well, I think anything that we say can and will offend someone, but if someone feels upset by something that you said, they have the right to their feelings. So we're not, you know, I could say something that upsets you, and I can't then say you're not allowed to be upset. You know, my golden phrase is feelings just are. That's it. You can't argue with them. You can't tell someone they're not allowed to be upset or they shouldn't be upset, or why are you upset about that? Because you just are. Feelings, they just are. I think that, you know, it's I do sometimes actually advise millennials that I work with, if they tell me about a situation at work, and I'm thinking of somebody I've seen recently who did have a situation at work where they were quite outspoken about something and it caused them some problems. And my advice to them was, actually, sometimes we do need to have boundaries around what is safe to share and what is not safe to share, because certain things can make us more vulnerable in the workplace, and it depends on how it affects you. So if that means that your colleague is going to treat you badly or not talk to you, or you might be excluded, or it might affect your job prospects, I think in any way, regardless of what the thing is, that if it makes you vulnerable and you've tested that out, then that's something probably to have some boundaries around in order to protect yourself and protect your emotional health and your mental health. But I think that the separate issue of, you know, Piers Morgan is of a certain generation, and I think, you know, millennials are born into a time where we are teaching and valuing personal enrichment and wellness, and we're asking them to embrace all these things. So why should we then expect them to be silent about their experiences? Because if they're becoming more enriched and spiritually aware and embracing wellness and self-care and individualism, we should fully be expecting them to be expressing opinions. And if we dislike their opinions, then we need to go away and deal with our own emotional reaction to what they've said to us. And I know that's easy for me to say as a psychologist, but in a work environment, or even in the world at large, if there are situations where people feel vulnerable, then I think you have to exercise your personal boundaries around what is safe for you to share and not share for your own, you know, progression and happiness. And
I think that's so crucial, everything that you've just said, because I think it's the closed-mindedness of maybe generations preceding millennials that kind of leads to this othering and the them and us. And I do really believe in intergenerational collaboration. I can see that a very special person is listening to this now, Fiorella, who is a brilliant mental health advocate, and you know, we completely engage with each other, and we're of complete different generations, but it's the listening and the understanding and the, you know, challenging what each other says and this, that and the other. And I just think it's so important to kind of create those relationships, that it shouldn't be like millennials, you know, creating startups and just trying to change the world on their own. It is so crucial that we seek help from people who have done it all before, have really, you know, slaved their way through it, paved, you know, the pathway. I know I owe thanks to so many female entrepreneurs who are much older than me, who have paved the pathway and have been the black sheep, making it more acceptable to be doing so. So I think it's so important that there isn't this divide and you can work together, because you know, people of older generations are so experienced. We can learn so much from them. We can't just go and do it on our own. That's the kind of, you know, bad entitlement from millennials, where you just don't think that you need to learn outside of yourself and your own opinions. So no, I really believe that, like, in what you've just said, and wanted to just touch upon a bit about the kind of concept of self-care and how that's becoming more and more, you know, the rhetoric around self-care is becoming much more frequent in loads of different aspects, from corporate wellness to, you know, NHS staff well-being is really being spoken about so much, especially because of the pandemic. So do you want to kind of get your take on, you know, why some people can view self-care as indulgent? And, you know, when you're saying I'm having a self-care day, I'm doing a digital detox, and, you know, it's really things to help you. But why do you think some people turn around and say, oh, self-care, that's so fluffy, that's so self-indulgent, you know, just get on with it?
I think that sometimes I don't like to categorize people, as you know, but I think that people that say that tend to be either of a different generation, or they're people that are disconnected from their own emotional experience for whatever reason, and it's not something that they would do, so they find it a little bit strange or odd, or think that it's not something that we should do. And I had a friend's daughter has recovered from an eating disorder about a year ago, and before the pandemic, one of her self-care things was to take herself out on a dinner date, and she'd go out and order her favorite food and have all her favorite drinks and desserts. And that was something she said, I'm having a self-care date with myself. And I thought, what an amazing and healing thing as part of your journey. And I think that it's become more acceptable for people to engage in these kinds of things, and we talk about them. Self-care wasn't even a phrase when I was training as a psychologist. It's very, very recent. And I think that this accelerated change that we've had in emotional health and mental health and well-being, we should want people to be doing these things, and we should be really pleased, because ultimately, if everybody can practice good self-care, which sleep, diet, wellness, exercise, and having a good routine, these kinds of things are actually going to prevent mental health problems and reduce the impact of emotional distress on people, and improve health outcomes generally. As you know yourself with all the work of NutriTank, that this is something that's so valuable to people in preventing, and those are the starting blocks actually. And I think for it to be called fluffy by people who either don't do them things themselves and are probably really stressed, or people that haven't needed to do them because they've had a different approach to life and just get on with things, that is I think that's that interpretation belongs to them, and we have to ask them, what do they, why do you think that? I don't think it's right to say that that's a fluffy thing. And actually, if more people did that, and we could get into more preventative healthcare around mental health and encouraging people to do that would be a great thing. Most of my patients do have sleep disturbance. They don't exercise, and they don't have a good diet. And actually, these are the fundamentals of self-care, and they're basic things. So people engaging in them, we shouldn't really be making fun of it. I think it's so dismissive and minimizing and invalidating. It's really horrible.
Completely agree with that. I mean, obviously I agree with that because I've spent my whole medical school career championing greater nutrition education and medical training. And exactly with what you said, if you're invalidating these really crucial pillars for well-being, like you said, nutrition, physical activity, sleep hygiene, mindfulness, relationships, all the different pillars, if you're invalidating that and kind of calling it fluffy, maybe not even acknowledging that there is science to it and kind of viewing it as a pseudoscience, is really not doing mental health prevention, mental illness prevention any favors, because there are these incredible techniques and things and small behavioral modifications that you can do to really help yourself get on a positive trajectory. So no, I couldn't agree more. I think it's really important that self-care doesn't get that kind of indulgent reputation. And something you've spoken about a lot throughout this is the kind of digital age and how that is truly intertwined with being millennial. I mean, I know that for a fact because there are some days when I'm just a bit too glued to my phone, but there's also COVID. Is what it is sometimes. But yes, I've grown up, always. I got Facebook when I was 12. I think that's when my parents let me. And from there, was on other social media platforms. So I just wanted to ask you a little bit about the subject of instant gratification and how you think that can sometimes tip into negative when it comes to millennials, and how we're so used to getting likes on our posts and getting instant feedback from all the digital things that we engage in. That is there a harm in sometimes having that and so much stimuli as well, when it translates, say, into the workplace where it takes longer to get promoted because you have to put the hard work in? You can't just snap the finger and get to the place that you envisage yourself that you want to be in. So just wanted to kind of unpick that a bit.
And I think if somebody has been really successful on social media, there's lots of young influencers, millennials, and then that doesn't translate into other areas of their life. That's definitely been difficult, and I've met many of these young people that have had that experience. Because if that becomes your worldview, that you are accepted and liked by the people, and And you're then in a situation where actually you're not getting that affirmation that you normally get on social media. It can be quite difficult. I think it's really important, and I tell people not to focus too much on how many people like their post or how many people, because it's a very easy trap to fall into, isn't it? That you go back and check how many people have viewed this and like this, and I think that you know, I'm on social media, I'm on TikTok and on Instagram, but you know, I'm mainly on these platforms to engage with service users. I'm not there to build a huge following and to become famous and to validate myself. I'm there to really try and help people. I come from a time where there's not been mental health provision. When I was younger, there wasn't such a thing as mental health services. In fact, we didn't even use the term mental health. And you know, my kids now freely say, oh, I've got anxiety, or that thing made me this, or you know, I'm having this. You know, it's part of their everyday vocabulary. And I think that, you know, if you know, I see my role on social media as providing education, which is why I tend mainly to engage with people who would normally be using services or service users. And I think if you're looking for affirmation and confirmation and validation from other people, then I think that's almost a warning sign to step back a bit and actually look at yourself. What is it that you want? Why are you on these platforms? What are you trying to achieve? I know for some people it's a part of their entrepreneurial journey or their business journey, and that's different. I think that, you know, it's related to, you know, their income and their life. But I think if we're looking for that to make ourselves feel better about ourselves, that's wrong, and something's gone wrong then. And I would say you need to work on looking at your self-esteem and where do you get meaning from? What is your identity? And why is your identity tied in with what other people like or dislike about you? How about what you like about yourself? And if there are things that you don't like, how can you identify them and work on them and improve them and make them, you know, make it into something that you do like and work on that? And that's where most of your focus should be. But actually, most people focus on external validation, I think, in the millennial, not all millennials, but in this.
I've definitely fallen into that trap many a time. I've definitely found myself in positions, like especially early on in medical school, where I always used to be seeking feedback. I always used to want to understand, did I do well? Did I not? Did you like how I did this? And kind of always inquiring. And I just, you know, through a lot of my own struggles and learning curves, I realized that I need to just have faith in myself and know that there's always room for improvement. You're always work in progress and all of this. And if one person didn't like you, fair enough. You can't be everyone's cup of tea, and it's their problem most of the time rather than you. And you can't let what they think of you have an impact on your emotions. So that is definitely something I've learned and really happy that I've learned. Because otherwise it's a downward spiral. It's so unpleasant to have to live your life wondering, oh, did I, you know, pitch that in the right way to really engage that person? Their eye contact was a bit funny, they didn't seem interested. You know, it's really important. And I really think that this type of education should be in schools from the onset. Exactly what you're saying around social media and how there can be those warning signs if you're not using it responsibly. You know, when you don't want it to get so far that you aren't able to take that step back and reevaluate. I really think that it's just inevitable that every child is going to be on social media unless they're a cult or whatever. And so I think from the onset they need to know, okay, social media is great, I can meet like-minded people. You know, look at you and I, like you can meet people with common interests, you can form an online community. I have such good friends who I've not met in the flesh yet, partly because of COVID, but online platform has helped us form that relationship. But you know, there really needs to be education on the flip side of where it can dominate you and make you incredibly unhappy.
Completely. And I think there's so many layers to that. You know, we just described their overthinking. You know, what if they don't like me? What if they didn't like it? Or their eye contact was not quite right, or they looked a little bit differently at me. You know, this kind of, we're looking to try and find out what it is that the other person thought about us. And actually, unless they told you, you'll never know. And it's a waste of time making interpretations about what they thought. And even if you did know, why should you care? about what they think. And I think especially sometimes, you know, people say to me, I'm really worried that someone's going to criticize me. So, well, if someone tells you that you're really crap or they really don't like you for whatever reason, the fact that they've been so nasty to you would invalidate their opinion, in my view. So why would it matter what they thought? It depends on, you know, who the person is. And I think that there's such a difficulty with that. And I think, unfortunately, social media is a breeding ground for envy and jealousy. And a few weeks ago on my stories, I do a Q&A on Sundays, and somebody asked me about how to not feel jealous of other people's success and that they're in relationships and you're not. And, you know, first of all, jealousy and envy of that kind on social media or outside of social media is a natural emotion. It gets dysfunctional and out of control if you really start to brood on it and think about it a lot, and it stops you from identifying what it is that you want. And often we feel jealous because we see something that somebody else has and we want that thing for ourselves, but we can't identify that, and instead we just hate on them and feel jealous of them. But then we keep looking at their stuff and then feeling even worse about ourselves. So I tell people, stop looking at their things and try to think about what it is that caused you to feel jealous. What is it that they possess that you think you should have? And then set yourself some goals and work towards them, and stop. It's a bit like if you've got spider phobia, stop exposing yourself to the thing that's causing your unpleasant and toxic emotional reaction that's really upsetting you. That you want to focus on yourself. But it's there's so many layers to this, and so many. I think you're right, education needs to happen in schools. It's not on the curriculum now in primary schools. It will be in the future, hopefully. But I think so many young people now aspire to being social media sensations or YouTubers, or it's where I think it takes time for the curriculum to catch up, and it'll be another 20 years probably before we get, hopefully less, but I think about now, transgender and gay and lesbian LGBTQ relationships, sex education has only started in the last few years.
Oh my god.
2 years ago was the first time one of my kids had it in secondary, and I was like, wow, that's taken a really long time to come about. It takes a long time for the system to catch up, but I think I completely share your view that it does need to be part of education.
Completely. And we're gonna have to wrap up now, but I hope the system will take a long time to catch up. Hopefully we can carry on. I know you do a lot of education, I try to do a lot of education. We can carry on really getting people to engage with these kinds of conversations to just hopefully make change on the ground. I mean, that's what we kind of did with Neutral Tank anyways. We were like, top down's going to take a long time, let's try and make local change. And so we can only hope to do that. But just wanted to say a massive thank you to you. It's been a wonderful conversation, a lot of food for thought for me on what we did discuss today. I think we could have gone into so many different
things.
But I'm going to say to everyone watching this, if there are areas and topics that you would like greater exploration, hopefully the lovely Dr. Kirren will get back on IG with me soon, and we can always pick things up if you wanted more detail and more focus. So thank you so much.
Thank you, Ellie.